Today I'm at Susie's nail salon, and I'm here to show some women that when it comes to your hands, your nail color isn't the only color that matters. Take a peek. Well, we're talking about hands today, and just we're looking at our hands. You know, I feel like we always and often look at this part of our hands.
Right.
We look at our nails, we look at our rings, we look at, you know, everything. How often do you look at the underside of your hands?
Not at all.
Not enough. Not enough, not enough. So let's take a look here. So a really nice, easy test for anemia is to take a look at the lines on your palm. See these lines here? They're nice and dark, and they're darker than the skin around it, which is great. That's exactly what we want. If these lines were about the same color as the skin around it, meaning a little bit pale looking, that could be a sign of severe anemia. So you want to be, perfect. That's wonderful.
I never knew that.
Yeah.
I have no idea.
It can be one of the many signs people can have, but it's still something to take a look for.
Oh, that's good to know. Thank you.
Absolutely.
Well done, Dr. Caudle. So, since I don't get my nails done in a salon, what do you think about mine? Give me a test.
Well, I actually think you're doing okay. We extend the hand a little bit. I can see the dark lines. I think you're doing all right. So keep up the good work.
A new version of palm reading. And there's, you know, African Americans are going to have darker lines normally.
Darker lines, absolutely. But the biggest thing is if that line is closer to the color of the skin around it, that's when we get concerned. So keep an eye out for that.
All right, let me move to a big test that you can all do quickly. It has to do with swollen legs. Let me see how many folks have swollen legs out here. Hands up. You got a victim right here. How are you? What's your first name?
Laura.
Okay. So how long your legs been swollen?
Oh, for quite a while.
Can I
Couple
see
years.
that?
Sure.
Couple years, huh? So Dr. Caudle, if you can, explain to us how you do. Oh, I can see it's indented even from the sock.
Yeah, you can actually see the indent here from the sock. You know, there's a couple things we can do to see if you got swollen legs. One of them is what we call the press test. And what you want to do is you just want to push your finger in at the lower leg, usually the front of the leg on the side of the bone. Push your finger in, and then when you release the finger, you want to see if a dent remains. And you do have a little bit of a dent here. Absolutely, yeah.
Yes.
Is this something you've talked to your doctor about?
Yes.
Yeah, okay. Well, good. You're doing the right thing. You're doing the right
Do you
thing.
know what
I
it's
hope
caused
so.
by?
No, I do not. He told me I have too many children.
I don't know. Children are pretty good, pretty good to have. Let's just go over this one more time so everyone's clear. So
Absolutely.
You press in the front by the bone.
Yeah, you want to press by the bone. Use your thumb. I like using the thumb because it's sort of a good finger to use. A good amount of pressure. You can kind of feel me pushing, can't you? Yeah. And sometimes it's a little bit painful when there's fluid in there, but you want to hold down for a good 2 to 3 seconds. And then when you release that finger, that's when you're going to see the dent. And if there's a dent, we can call that pitting edema or swelling.
So everyone just do that, if you don't mind. Don't be bashful. Let's just, I'll go back here. So, no, none there. Just, try to do that test. Again, you're going to press it. I'll do it myself. Find the bone. Just come over by the bone, some spot in the front, and just press down.
Yeah.
And you can use your thumb, which I think is wise, or any finger.
Good. It's good. So
And again, you're going to look for the kind of pitting. That's what it's called. I'll show you a picture of what pitting looks like. You see that image there? That's pretty typically. Don't be oohed and awed by it, because lots of very benign, easily fixable things can cause that. But if you don't know you have it, and your doctor doesn't know you have it, they can't help you. So, Dr. Caudle, what do you recommend to anybody if they haven't talked to their physician?
Absolutely. Well, so the biggest thing is, why is this happening? It can be a sign that the veins are having some issues in the legs, or it can be a sign of a larger problem, like heart or lungs or things like that. You got to see your doctor. You know, honestly, most of the time, this can be treated sometimes with elevation of the legs and like a low-salt diet and compression. But you got to figure out that you know what exactly is causing it first to know that. So see your doctor. That's what you're doing. So I'm happy that you're doing that.
Thank
so it's
you
great.
very much.
I'm glad you had the kids,
Thank
by
you.
the way. Do one at-home test everyone can test themselves for sinuses with. So we all learned in medical school something called the TAP test.
Yeah.
So teach it to the audience if you don't mind.
Absolutely. So the TAP test. So this is the time of year, right? You're wondering, is my congestion due to allergies, you say? Is it due to the common cold? Is it a sinus infection? Well, one of the things you can do, if you've already got congestion, a little fever, not feeling so well, is you can do the TAP test. And that literally is pushing along the sinuses, the maxillary sinuses, which is the cheek. And then, oh good, you guys are doing it.
Here's the
This is
image,
great.
by the way.
Yeah,
Those
this is an
pink
image.
areas are the main sinuses. So there, you see the cheekbones ones.
Right.
You see the ones above your eyes, too.
And the ones above the eyes, absolutely. This is something I do in the office all the time. Will you be my patient for a second?
Please.
Okay, so this is what I do when I'm in the office.
Ow!
Oh, hey! You gotta be a better patient than that. So what I do is I'll push underneath the eyes and ask the patient if they have pain also above the eyebrows too. That's something you can do on your own. And
Do it back here, too. That was good.
massage is not included. But the biggest thing is, if you've got pain when you push, it may be an indicator of a sinus infection. The biggest thing is you got to see your doctor, of course, but sometimes pain at the sinuses with pushing can be associated with an infection.
Everyone just do this for me so I know you're all okay. Press here, just above your cheeks, under the eyes, and then above the eyes, then in between the eyes. Now, and if you remember, if you got a problem there, it could be help with things like the neti pot.
Absolutely,
Could be looking
saline
for
nasal
allergies.
spray,
Yep.
you know, things like that are really good.
I know you're afraid about going to see doctors about this stuff. See them because they can help you, but most of the time these things are easily managed once you know you're safe.
Right.
All these 60-second health tests can be found on DrOz.com. We'll be right back. Very nice to see you guys.